whenever there is a imbalance in the vibration in our body, we get diseases or disorders, right? This means we need some other vibration to cure us. When a person with high anxiety, high stress level comes to me, how do I treat that person? We have to definitely take care of the nada. In our system, there are a lot of sounds going on. We don't realize. When we are very anxious, so what happens? A lot of sounds which are not very healthy for us that go on. So music as an audible sound, right, is administered to us, that works on the inaudible sound to take us from one state of the nada to the other. How nada is created? So nada is created by forcing a shakti on the pranavayu. What is the meaning of nada? Na means pranavayu, da means agni. Agni is the force, literally is the force. So when you force agni on na, that is pranavayu, what happens? Creation happens, spandan happens, vibration happens, everything happens. So first and foremost, I'm still a student of Indian music, and or of music therapy as well, and will be one for the rest of my life maybe. And I'm practicing as well as learning Indian music therapy, as there is no end to learn about this genre of practice, right? So today my topic is the versatility of Indian music as therapeutic implement. So to start with, I'll just take you through very briefly what is in music therapy and how it works and why it works, and then we'll go to the topic, right? So what is music therapy basically? It's music therapy, if we have to define it really, it is the intervention, music intervention in a structured, in a systematic, in a customized way and scientific way to realize the required outcome of a patient or a client. Why I'm saying a client as well? Because music therapy is not always applied to the patients, it is for everybody, right? Secondly, it has to be within a therapeutic framework. So certain kind of ethical limits we have to follow. So that is why it is said it is within a therapeutic framework. And as therapeutic practice, music therapy also offers, quantitative outcome through experiments, as well as qualitative and observational outcome through experience, right? And mostly music therapy is applied for realizing non-musical goals, and in the procedure maybe some musical goals also are addressed. And so far as a concept, music therapy is used as an adjunct or integrative therapy with other therapeutic measures, but it can very well be independently used as well. I'll be taking you through a few case studies where I'll tell you why it can be considered as a independent music therapy, I mean therapeutic practice as well. Then I'm not going to the other parts of it. Last part is very important, how we design music therapy. It is extremely important to keep certain parameters and certain thoughts in mind when we are designing music therapy. First is the condition, of course. Second comes age, and then the background, cultural background, social background, right? What is the state of mind? What is the food habit of the person? What is the color choice? What is the other choices of the client? Everything is inclusive when you are designing a music therapy. So it is creative as well as scientific, as well as based on the culture. We'll see how it is related to the culture and all other parts, all other pointers that I have mentioned here. And thus it follows a complete diagnostic process. Okay. Now each patient is different, as I told you. If we take an example of crocin, we give crocin to 5 people having headache, 99% chance that 95% of the condition will be addressed. But the same music therapy may not be effective for 5 people having headache. So we'll have to design it according to the subjective requirement. All right. So next, why why music therapy works. Music is the only art form that works on the whole brain, right? No other art form works on the whole brain. It gives the whole brain a complete exercise, and all the information from the brain only distills to our body and other parts of the things. Melody and rhythm are the two innate and natural resources that we are born with. As soon as we are born, what is the first thing we do? We breathe, right? So breathing comes from where? It's energy and vibration. And whenever there is a vibration, there is, there ought to be a sound, right? So with and pattern, rhythmic pattern we follow. Without pattern, there is no rhythm inside us, right? We are made up of cycles, we know that. So this is very important. And how many of you believe that music therapy works? Okay, great. So this is the first step to be cured or to be healed by music therapy. Unless and until you believe that music therapy will work, it will never work. Second step is the trust that is generated by the music therapist for the patient or the client, right? Now how it works? As we were discussing that we were made out of vibrations and energies. The very first breath I was talking about. So as soon as we are born, the vibration starts in our body, right? And vibration comes from energy and air or whatever process it follows. We'll be seeing it later. So we are made up of energy, vibration, and all this stuff. So whenever there is a imbalance in the vibration in our body, we get diseases or disorders, right? This means we need some other vibration to cure us. Yeah. So what happens whenever there is a problem with the vibration, or vibration is imbalanced? What happens in a particular area of your body? The organs related to that part also gets affected. The functionality of the organs also are hampered. Obviously you get disease at that time. How music helps in this case? Musical sound is energy, right? Or no? Yeah. Okay, so energy from musical sound enters our body through the sensory organs, and brain interprets it in a different way, in impulses and all, and it distributes it throughout our body. So yoga says the energy is distributed to our body through the nadis, the prana pathways or energy pathways or nadis. There are 72,000 nadis. According to some beliefs, there is 350 100 nadis as per some other beliefs, right? So let's consider that there are a lot of nadis inside us through which the flow happens, energy flow happens, right? So when musical energy is being interpreted by the brain, and as per signal it is distributed through different parts of our body, it also reaches the part where the vibration is imbalanced. It gives that energy to realign the vibration. You can see the third point that I have meant here. So it realigns the vibration. Along the way, there are a lot of neurochemicals also are released, right, by the system, by our system. And those neurochemicals help the organs associated at that part to get healed up. So that's how we, become healed up with musical energy. This is the simplest way of explaining. But still there are lot of questions remains even with the scientists, how music works when it works. There are a lot of questions, but still they have found a lot of answers as well. So there are neuroplasticity happens, more neurons are created, you have the neurogenesis, then brain, whenever neurons are generated, what happens? A lot of communication happens in your brain. So whenever there are more signals, more communication, definitely there are ways to heal up faster. So these are one of the reasons. If I have to just connect this with one of the very recent experiments done by Dow Wallace. He is actually in this mitochondria research for the past 50 years, and he says without energy we are nothing, right? So even Western scientists also are saying that without energy we are nothing. 90% of our cellular energy is generated by mitochondria, and mitochondria, if it is depleted of energy, you get a lot of diseases like neurodegenerative diseases, neurological diseases, autism, lifestyle related diseases, lot of other things, right? So this is the very recent research that is being conducted, not been conducted, being conducted, is going on, ongoing. Now, what are the application areas? As I can say, there are many application areas. I have just, pointed a few or listed a few. Starting with, as I said, neurological disorders, then children with special needs, diabetes, depression, amnesia, all these things can be pain management. Occupational disorders. Occupational disorders are healed up by music therapy a lot now. This is one of the areas that I am very interested in and I'm working with. So, and it works for everybody, for children, for elders, for elderly, for young adults, for all right. So I'll go fast in this few slides and then we'll talk about things. What are the diverse approaches that are, taken up by the music therapy practitioners in India now? Only with Indian music therapy. I am concerned only with Indian music therapy here. No other therapeutic approach I am considering. Just Indian music therapy. So, the very first point says active and or receptive. What does it mean? You can take part in the music therapy process, or you can just be a passive recipient of the music therapy process. Say for example, I am singing, I am a vocalist, I am singing and you are listening to it the way I am doing and you are receiving the vibration, or you are taking part with me as well in playing instruments or rendering music or singing or whatever it is, right? So what are the different approaches for this? Through Indian classical music, maybe Hindustani genre and Carnatic genre, or either of the two, right? Classical music based songs. It can be bhajans, it can be mantras, can be devotional songs, can be folk music, can be music, popular music in local region, local languages, all right? Extremely important point. We'll come to it and see how these are related, yeah? It can be either vocal music or instrumental music or the mix of both. Chakra energizing with swaras and ragas. This is one of the area, it requires immense skill. You need to know how to do this and only then you can apply it. So it's based on, tantric practices that have come from our ancestors, and I don't know since when the Shakti Puja was started, and since then it has distilled down to us also, and those practices we are following here as well, right? So what is the theme, core theme of music therapy through chakra energizing is you get your body rid of all the impurities through music. Through music, you are energizing the chakras so that all the impurities are gone from your body, and that way it eases the energy to flow easily into your body, right? And you are out of your diseases or disorders, whatever it is. So this is the core theme. In India, I would like to refer one name. She is Rajam Shankar ma'am. She is based out of Hyderabad. She is one person who is practicing this approach for the last 20 years. And she has got not less than 3,000 successful cases with her. I have spent a lot of time with her and seen how she does it and what she does it, and it's extremely, extremely powerful. But somebody who is practicing it needs to know it. We'll be discussing more about that. Next comes Tal, Lay, Bol. Without rhythm, we are nothing. We are born with rhythm. So, what does Tal give us? A complete framework within which we actually design our music. In whatever way we are singing, we have to design our music within the framework of the Tal. We start with, say, Som, start in the Som and come back to the Som, right? Lay. When we are walking, if the two legs are not in coordination, we are going to fall, right? If they are not paced properly, we are going to fall. So what is the concept? It's the concept of Lay, the pacing. If pacing is not correct, music will not be nice. We will not be nice. Okay, we'll get diseased. Next comes Yogasana with Indian music. So you can see that it's complete holistic approach that we take up for music therapy practices. And there are other ways, like Indian music with sensory cues, like visual cues. You can take auditory cues. Auditory cues already there with the music, and there are others like anesthetic cues and other cues. So it's very important for treating children with special needs. It is important, and it is a must, actually, we can say, right? So these are the ways music therapy practices are done in India right now. This is the major ways. There might be some other ways as well, right? And most importantly, whatever approach you are taking, that approach has to connect to the patient or the client. Only then it is going to work, otherwise it will not work, right? Next. So before going to the next slide, these practices that we are talking about, there must be a source from where this practice methods and the technologies are coming or techniques are coming. Definitely Indian music is one, right? Sorry. Definitely Indian music is one, and we have seen yoga also is one. So where are those hidden? So let us see some of the references which will give us ideas of from where these practices are being taken up by music therapists, right? The very first point is our Pranava mantra. Scientifically and historically, we know that the whole universe is, created from sound. The Pranavana. The Pranava is pra and Nava. Pra means before and Nava means new. So Om existed before anything else. We do not know where Om comes from and how it works in our body, right? But it works. Okay, so the whole universe was created from Om. Om has 3 syllables, right? O, Ang. So these 3 syllables are the main fundamental notes or nadas from where whole universe is created, and even our Saptaswaras also are being created. Because these are the only 3 fundamental notes. Until now it is scientifically proved, and it has been understood and researched a lot. And the effect of Om, we have seen and we have felt, our ancestors have felt, now our scientists are also feeling that the importance of Om is immense, how it works, and they have done a number of research to prove this, that Om, the sound of Om cures us of lot of diseases. So I'm not going into this. Also Mandukya Upanishad says that what is, what will be, and what was is all Om. Fine. Next, so we have seen from Om the Saptaswaras come in. First reference of Swara from the existing books or text that we have is Rig Veda, that talks about 3 Swaras, Udat, Anudat, Swarit, right? When we go to Samaved, takes it to the next level from 3 to 4 to 5 to 6 to 7. So 7 Swaras are mentioned in Samaveda, and we see that the organized music that we are using today, or we are part of today, is attributed to Samaveda, right? So the Samaveda actually has is based on the concept of complete holistic living, right? And that holistic living and the concept has come to our Indian music structure, right? And that is the reason maybe in none of the texts, ancient texts, we do not find any mention of music therapy, Sangeet Chikitsa or anything else. It was not required because it was part of the holistic development, the growing up and development, and that's the reason, right? We will see some of the references now. First is Nardiya Shiksha. I have taken a few books where I could see that the importance of music therapy could be connected, right? Nardiya Shiksha. So he actually mapped the swaras that were given in Samaveda to the swaras that we sing today. Maybe the order were different, but he's just made the mapping. Then he also connected swaras with different colors, gods, and you can say animal, birds, and different body parts, all those. What is the relevance? Kala. We have heard a lot of stories like the sages, when they do the sadhana and when they energize the chakras, they can see the kalas, right? So see where from it is coming. The God part. So in our tradition, in our culture, we say that all the gods are within us. Swaras are within us means gods are within us. So the connection is made. Animal birds, the sound of animal birds and all are connected so that the feeling of rasa and bhava could be given, right? So these are the connect. So later we see how those have come. Also, very interestingly, Narada has explained in his book Naradiya Shiksha, Saman singers, when they used to sing, they used to touch different body parts like head, forehead, throat, thigh, and all those parts. So now, when we do music therapy today and talk about fine motor skills and gross motor skills improvement, what we do? We do this with, body parts, movement and all this stuff. Where this is coming from? Here, the origin is here. Again, he also mentions that as per Samagana, they used to have the swaras connected to the, fingers. And we all know that these fingers are all connected to some part of our body. Like portion of the fingers is connected to some part of the body. Means if I touch this part, these two parts mainly are connected to pituitary gland and pineal gland, right? So we can stimulate those glands right from here. Can you see the importance, therapeutic importance, how they could connect it at that time, and we are using it right at here. Okay, so this is one. Next comes Natya Shastra, one of the best. It is not one of the best, it is the best treatise we have for the performing art that you can tell about or talk about, Natya, Nritya, Sangeet. He has given all the things, Bharata Muni, in this book. Two major concepts that I can relate to very well with music therapy practices, current music therapy practices, bhava and rasa. Very, very important. Without that, music therapy will not work. Unless and until I, as a music therapist, emote bhava, I cannot evoke rasa from the person or the patient. It is not possible, right? So this is extremely, extremely important. Second comes kakus. Kakus are what? They are the voice culture techniques to emphasize on rasas, emphasize on alankars. So this is also very much important, and there are n number of cases of thyroid problems which were treated with voice culture. This is not one, two, there are many cases where treated with only voice culture, only singing swaras through the vocal cord, right? Next comes Brihadesi. Matanga Muni mentioned that, about rag. We are not going to it now. And nada. Nada is the one main very important part and concept that existed right from the starting of Om. And he said, without nad, there is no sangeet, no geet, no swara, nothing. Nanadana vina geetam, nanadana vina swara, nanadana vina nritya. That means without nad, there is nothing. So concept of nad comes from here. And Brihadesi also gives two very wonderful concepts, and this I have got from a book called A History of Indian Music, written by Swami Prajanananda. He says these two concepts come from this first two lines, comes with the Vaishnav concept, and the last four lines come with the Tantric concept. So first two line means that how you listen to nada, how you hear nada, as Brahma, as Vishnu, as Maheshwara. We are familiar with Brahma Granthi, Vishnu Granthi and Shiva Granthi, right? Maheshwara Granthi, right? So Rudra Granthi. So this comes from here. The next four lines emphasizes on the fact that nad, how nad is created. So nad is created by forcing a Shakti on the Pranavayu. What is the meaning of nada? Na means Pranavayu, Da means Agni. Agni is the force, literally is the force. So when you force Agni on Na, that is Pranavayu, what happens? Creation happens, Spandan happens, vibration happens, everything happens. So here in the this 4 lines, he mentions that the pranavayu or nada is generated from our body, the Brahma Granthi. All right, and if we refer, so there they talk about the Muladhara Chakra is residing on the Brahma Granthi. So how it is connected to the swaras we will see just now. Then also they talk about 4 levels of sound. You might have been familiar with alpha, beta, gamma, delta, theta vibrations. This very this thing frequently used for for stress management and all those stuff. They say that if you're very stressed, you have to be taken from beta to alpha to delta to theta, or theta to delta, whatever it is, right? So this concept was given first in Rig Veda. In Rig Veda it is said that there are 4 levels of nadas. So one is the one which we speak, vacho manusya, for the manusya vadanti, and the 3 others are hidden. All right, and this concept was later elaborated by scholars and grammarians like Bhartrihari and all, Parapashyanti, then Madhyama Vaikhari. Okay, so that's how. Same concept is given by Brihadisi also. Why it is important, why I am mentioning this is, when a person with high anxiety, high stress level comes to me, how do I treat that person? We have to definitely take care of the nada. In our system, there are a lot of sounds going on. We don't realize. When we are very anxious, so what happens? Lot of sounds which are not very healthy for us that go on. So music as an audible sound, right, is administered to us, that works on the inaudible sound to take us from one state of the nada to the other, right? And it then balances out us from that high stress level or high anxiety level to a relaxed level or other parts. So this is the concept. So when I am talking about alpha beta, this is 1970 born, and these ones are, I don't know how long these have been with us, right? For next comes Sangeet Makaranda. This is again another extremely important book from where we can get lot of Indian therapeutic practices, tips. This is also written by Narada, but this is not the same Narada, because one Narada cannot live in 3, 4, 5 centuries. So he is different Narada, right? So he gave a swara and rasa connection. Okay, now we know when swara is rasa means what? There are different types of rasa, right? Like Veera Rasa, Adbhuta Rasa, and 8 rasas that Natya Shastra tell us, like Bibhatswa Rasa, Hasya Rasa, Shringara Rasa, and all other types. So he has connected swara with rasa, this Narada. And then he talks about ragas based on location and people. He has named ragas based on location and people, right? Why it is so important? Let's take a very small example. Why the food habit of North Indian people and South Indian people are different? Why do you think it is different?
Different kind of grains grow.
Yes, okay. And?
Cultural
difference, okay.
Genetics are
that is what? The constitution of their body likes or understands that pattern, food pattern, and only they can have this. Right? This is very, very important. Very, very important. If we have the food habit, if we take the food habit of North India and start practicing it in Shillong, where I am born, will not live properly. It is not possible. The condition, climatic condition and all will not allow us to live. We have to have the suitability of that place, right? Similarly, and this is very interestingly, this is proven by the same Dorwallis about mitochondrial energy. When he talks about, he says that mitochondrial DNAs or mitochondria are mismatched today, because today the lifestyle that we are trying to take up or adopt, it is not matching us because it is not ours, and that is why a lot of lifestyle kind of diseases are happening. All right, so that these things were understood by the people long back, they've created sound or music as per the requirement of the location, requirement of the people, right? So that is, and that is so therapeutic, because if you, for example, I'm a Bengali, and when I'm developing a music therapy or designing a music therapy for a Bengali person, the first thing I'll think of a Rabindrasangit, that is Tagore song. First thing, because Bengali people and Rabindrasangit cannot be separated. They're born with that, and definitely it is going to heal them up. So this is how it has to be designed and thought of. When I told you, local language music has to be implemented, these people is, genius people have thought of it long back, and we are just taking the part of, or, pieces from their concepts and vision. Then again, he emphasizes on how nada passes, starting from Brahma Granthi, it goes upward. He talks about Nabhi Mula, but actually it is around that area itself, all right? Then he also talks about Sharava, Aurava and Sampurna Ragas and their therapeutic effect. Okay, why Sampurna Raga should be sung, why Aurava. Sampurna Raga means with all the 7 notes, Sharava Raga means with all, with 6 notes, and Aurava Raga means with 5 notes, right? Pentatonic ragas. So what are the influences? These also he explains. Next comes Sangeet Ratnakar. So Sangeet Ratnakar, when we see, when he compiled this in 19th century around, 13th century, sorry, it was around 13th century. All the concepts from other scholars were compiled in Sangeet Ratnakar, right? So we get the essence of whatever we have discussed so far, along with one very, very important thing is the chakra. He explained chakra so well. Why? We can understand, because by that time, by 13th century, all the like Shaktism, Tantrism were part of our lifestyle, and those concepts he brought into music as well, right? So when we talk about chakra energizing through swaras and doing the music therapy in that approach, so definitely it is, we can attribute this to Sangeet Ratnakara, is attributed to that. Next comes the versatility of Indian music as therapeutic implement. Like whatever we have seen so far, can you just see how deep rooted our Indian music is, and the therapeutic concept that we are using today, these are. So we are using everything, right from Nad, from yoga, from music, from Shakti sadhana, Tantra sadhana, everything is included in that, right? Now next comes versatility. So this is where we are applying all the concepts that we have discussed. Just in 7 swaras, so it is as I told you, 7 swaras were connected to rasas. So 7 swaras are used to energize the chakra and get the body rid of the impurities, etc., etc. So you can understand how important the swaras are. First thing. Second, Vadi Samvadi swaras means Vadi swar is the most prominent swar in a rag, and Samvadi swar is the very next prominent swar in rag that we use, right? So when we are designing a music therapy, we have to take care of these aspects also. I'll be giving you examples when you will understand. Alap. Alap is what? It is literally introducing the music piece or rag to the audience or to the patient that is sitting across, right? So when I say alap, how do I do an alap? Say, I take a small example, say Yaman rag I take. It's a very basic rag and first rag generally taught to everybody from Hindustani Sangeet perspective. So so how I am moving from note to note here. Literally I am moving from note to note to describe the raga and introducing the raga to the people. all right, or the patient. So already a trust is being formed. Second comes the Vistar. Vistar is what? It's purely focusing on a note and then moving from note to note. In Alap, what we did, when we are moving from note to note, it is faster, quite fast, with a lot of alankaran and all this stuff. But in Vistar, it is not so. If I am standing in a note, I have to stand and focus on a note. So we can talk about mindfulness. The focus can come from Vistar itself. Just say 2 notes I have sung, but how much space I have given between the 2 notes, right? So that's how it works. So next comes Bandish. Bandish is what? It is like you have lyrical compositions and you can create a mind map when somebody is singing the lyrics. All right, and there is visual stimulation, there is an auditory stimulation, there is feelings, that is kinesthetic stimulation. Lot of things can happen with Bandish, and that is in your own world of thinking, right? Next comes Tan. Tan is what? Very fast movement between the notes. Ni re ga re sa, ni re ga ma pa ma ga re sa, ni re ga ma ba da ma ma ga re sa. How much control do you require when you are doing it? Huge control you require from the perspective of tal, from the perspective of swar, everything. So you have to be totally focused on what you are doing, right? Creativity comes in. What is the next step you are taking? What is the next, combination of notes you are thinking of? Creativity, intuition, focus, control, everything can be enhanced with this music, with Tan and all. Decision making. What is the next notes I am going to concentrate? Quick decision making. So this is very, very important. Tal and Lay, already I have told you the importance of those. Pole. When we do, recite Tal, right? Say for example, this is a part of music learning also for Hindustani music, as well as I think Carnatic music as well. So for example, if we talk about Sri Tal, so how we do it with the hands? Da din din da, da din din da, na din din da, te te din din da da. Right? So what is happening? Your oral motor skill also is improving. Your fine motor skills also are activated. Right? This we have seen in Samavedic, Saman song, Samagana, that Narada has explained. So these have come, all the concept has come from this part. Movement of body parts, of course, when we are doing it, no singer can sing, like classical singer can sing without moving their body. So I don't think so. It is not possible. When you are singing, your body parts from inside is moving, your body parts from outside is moving, and these are extremely, extremely therapeutic as well, right? Part of exercise or yoga. So let me take you through one example of music therapy, right? See, a recent case I'll just discuss. A person, a lady who has come with hopelessness. She is about 69 years of old, and she has lost all hope in her life due to different reasons, right? She was very brilliant in studies. She got through her medical entrance but could not study due to family reasons. Then after marriage also she was deprived of a lot of things, and now she is totally withdrawn herself. Her expression is gone. She is suffering from that hopelessness. She has come to me. So how we are going to treat her? With music. So I asked her everything. So she told me that she likes only bhajans and Bollywood songs which are very old. All right. So in that case, I cannot use Chakra Shuddhi process. Chakra Shuddhi process will take us through only movement from swaras to swaras. She will get bored. She will not accept that. It will not work on her. So we'll have to take up some songs that are also raga based, right? And also of her taste. All right. So first, in that case also there is some other aspect that we have to take care of. She is suffering from hopelessness. When you suffer from hopelessness, what happens? First, feeling, where does it come? Where does it come in your body? Heart. Madhyama. Ma is associated, the swar ma is associated with heart. Right? So I have to design something around ma. Okay? So first clue I have got. Then what happens? She said that she doesn't like to talk to people. She doesn't like to go to gatherings because people ask about family and all, and she is not in a position to respond back. So her expression is not there. Mood shift, right? So it's kind of this area, dha, right? Okay, madha we have got. She has lost her expressions. Pa, throat, all right? Yeah. So all these things I have to take care of. Okay. So and another point is, due to this, she has lost all coherence in her. She forgets things. Even if she doesn't forget, she thinks that, she is suffering from forgetfulness. That is, her basic infrastructure is shaken. Sa, the first note that is connected to the Muladhara. So I can think of one raga is I can connect to the raga. So I did not know whether she will be connecting to it. Only with these information with me, I thought I'll take up Kedar. Right? Sa ma ma pa ma pa da pa ma sa ma ma re re sa. Little bit of tivra I have also used. It gives a hamir kind of feeling. There is some reason why I've given that. So these, around this I have to think about. So first raga does not come. First notes come. Looking at the conditions, first I have to think. So then I have to think, now I cannot sing classical music because she doesn't like those. She likes only film songs or bhajan types of songs. Then first song that comes to my mind is, Humko man ki shakti de ma. And fortunately she likes this. So the first step is achieved. And then you have to see other aspects as well. So very step by step, creatively thinking, you have to design what is going to work on what. Along with that, you have to also introduce the swaras. Otherwise it is not going to work. It is not just you sing the song and it's done. No. Swaras also has to be included in that. Now, let's come to another case. I'll take up only one raga and discuss case by case. Because as I told you, it is not raga that is working. This is a combination of notes that is working, depending on the disease or disorder. Next case, say for example, a autism child comes to me, right? And you know that how autism, there are a lot of different, symptoms of autism. The autism that child that I'm talking about is having, less curiosity. This is the very common issue with most of the autism children, right? So curiosity is not there. So they are expressionless. They do not want to mix with people. Social bonding is not there. So do you think the thing that I have designed for the lady will work with him? Again, the curiosity comes from heart only. This. But yes, I have to focus on ma as well. But these same design will not work here. I have to make it a little bit more interesting, right? So maybe I'll be giving them some visual cues like this when I'm singing the songs, right? Or giving some kind of body movement. Whenever he sings, and autism people or any other special child require very slow treatment, okay? I cannot sing tanas in a very fast mode. So I can say sa sa ma ma re re sa sa. So this whole composition, I can tell him to do it like sa sa ma ma. Let them sing sa sa ma ma. Then re re sa sa, re re sa sa. Okay, so this is how the progress has to be done, right? Then with this, I have to tell them, okay, do the body parts movement. Whenever there is movement in your body, you get energized. This is science, right? So this also has to be applied for the conditions, based on the conditions that are coming to you. All right. So next, this is one thing I used with a Down syndrome patient, Down syndrome patient kid. They have a heavy tongue generally, right? And they learn very well from visuals. All right, it is proven that they learn very well from visuals. So if you give this one with the visuals, anyone knows the song? This one, Chanda Chanda Mama. Chanda Chanda Mama, आज मेरे घर आना, साथ में तारे सितारों को अपने संग ले आना. Okay, so this is the song. If you see this, like, there are a lot of importance given to the wordings. Chanda. When you pronounce Chanda, what happens? You are touching your palate and it is moving. The tongue is moving, the palate, it is touching the palate. So it works on the heaviness of the tongue for the Down syndrome kid or any other people who are having, say even for aphasia. So it works. Who are say a Parkinson disease patient who comes to you and they're having speech problem, this sort of things will work. And visual, why visual? Because they learn better by visuals. So this is the way you have to think of creatively to administer music therapy. So this approach, this particular approach goes with the last approach I told you, Indian music with visual cues and all. So these are the different type of approaches we can use, right? And then take them to the nature. Like any patient or anybody for that matter, even we should be associated with nature. If we go to the nature, there are a lot of sounds. They're so healing, and all those things are defined in our texts. Even whenever I was speaking about Narada for Sangit Makaranda, I don't know with what all he has connected the swaras. Dweep, God, place, stars, nakshatras, gotras, all these things he has done. So there must be some significance. It's a huge matter to research. Okay, now I'll be discussing a few case studies based on the approaches that I have discussed. She is Meenakshi Ravi, Dr. Meenakshi Ravi, and the girl with her is Mridula. She's a schizophrenia patient. They stay in Bangalore. She is now Dr. Meenakshi Ravi has moved to Hyderabad right now, but she was in Bangalore. This girl was treated by her for not less than 8 years, right from the first symptom of schizophrenia, and now the girl is working in his music school after completing her Carnatic grade music exam, and she is independent to go out station and take children's also out. So she is that much capable now, and this lady is working only with children with special needs, and I have met them, and I can say that easily she has the highest of success stories of curing people with or children with special needs through music. She uses only Carnatic music and Carnatic music based bhajans or those sort of mantras, and she was not under any other therapy. No other therapy was administered to her, only music worked. So we can easily say that music therapy can work independently as well. Right? So we have seen two ways, like Rajam Shankar ma'am I have spoken about, who is working for 20 years with chakras and Swara connection, and she has got a lot of success stories. I've spent time with both of them and I have seen how they work, and very authentic, and that's the reason why I am using their examples here. Second, this is one of my case studies. She is based out of Faridabad only, and she's having rheumatoid arthritis. Issues that we are dealing with is movement, motor issues, coordination, balance. All right, and music therapist is me. I haven't written that. And approaches yogasana. Yogasana was introduced by my husband to him because he's a yoga practitioner. He did, and I was using music therapy with her. So she was using other therapy. We started her treatment September last year, I believe, 2008. Yeah, September 2018 we started. All right. After 4 months, her coordination and balance, gait, that is walking pattern, was improved to great extent, to very good extent. All right. So we can say that music therapy really worked, because there are a lot of things that we administered with it, with music also, yoga and music and rhythm therapy. So these did not happen when she was taking other therapies like, you know, physiotherapy, Ayurvedic massage and all this stuff, right? So when we started this, after 4 months, we saw this improvement. So we can easily say that music and rhythm therapy really works. Now we are doing, this is the position from where we can, you know, move to do some quantification. When we are doing music therapy, instant quantification experiment is not feasible at many times. We have to do some observational experience or experiential, you know, measures, or only after that we can go to the experiment part to quantify things, right? So now we are in a position to see the different parameters that has improved in her gait, and that will take a lot of time. It is not a one-day thing. Music therapy really takes a lot of time. Music rhythm therapy or whatever it is takes a lot of time, and it will be maybe you know, 1 year also it can take to see a little improvement in her, because of her age, because she is 67 years old and her disease is progressive. 40 years since she was 40, she developed this disease. So now she's 67, so it's very, very old disease. So it will really take time to get the rehabilitation done. I'm not saying that we can do the, you know, cure of the disease. There is no cure of rheumatoid arthritis so far, right? We can just do a rehabilitation for her in this, so that the disease symptoms do not deteriorate further. So this is one. So these are the 2 case studies I thought I'll discuss. Then I'll take one raga, because I do not want to take a lot of ragas. One raga that is being researched by a lot of people, and this rag has worked in different type of symptoms. This is Darbari Kannada or Darbari that we know as. So first, as you can see, this experiment was done by Ayurved Mahavidyalaya, Anganwadi. So they experimented with Raga Darbari and found that it works on insomnia. Okay, the same was the third point. If you look at the third point is about Pandit Jasraj. In his interview, he has told that he himself as well as his father used Darbari Kannada for insomnia. It treated insomnia. Okay. Second one, if you look at very recently in 2018 December, one girl in Kolkata hospital, she was brought back from coma with Darbari Kannada, with the rendition of Dr. N. Rajam's violin. All right. So can you see, the same rag can put you into sleep and the same rag can bring you back from coma. How versatile our Indian music can be, and how we can use this to treat different, you know, symptoms. Next comes Pandit Jasraj used the same rag for a Pune-based hospital, all right, gynecologist hospital. Gynecology hospital, for reducing maternity and pregnancy pains, right? So this he has told in his interview. It is available in YouTube, you can find it out. So this he has told, and it has come, and he has also given the measures. The analgesic or, you know, pain relievers were reduced from 150 mg to 50 mg. So that's what is mentioned. IIT Kanpur students and professors did the research on the same rag and found that it is a huge stress reliever. So the concept that one raga works on one kind of ailment is a total misconception. It's totally, as I told you, it is the combination and how you administer the raga will work in a different way. So one raga can work on this type of different type of symptoms. This is feasible. The last part of this presentation is what we need to do now is, we have seen what sort of treasure house we have got from our ancestors, and from the great musicologists of, who have been writing books for or text for 1,000 years or 100 years or some 100 years. So our responsibility is to take this to the next step by experimentation, by documentation, and emphasizing on the efficacy. Definitely we cannot standardize everything, but at least some good amount of documentation we can do, so that the generation that is coming next, they can have a steady reference or ready reference for them, and from there they can take it to the next level. So this is our responsibility. For this, we need to have solid music therapy course in India, which is some courses are there, but they are not totally aligned to Indian music. Or I can say there are two names, I can take two institutes names. One is Music Therapy Trust. They are actually based on completely Western music, so they are providing diploma also on the basis of Western music therapy. Secondly, and this is the certificate is provided by one Indian university. Another university or another institute, I'll say, is offering diploma course is Chennai School of Music. They are of course dealing with Indian music and other techniques, Western techniques as well, but the certificate comes from a Western university. We require something totally which is based out of India, the Indian music therapy given by Indian university, okay, or Indian music therapy course given by Indian music or Indian university. So that is very, very important. So this is the first step, and second is the documentation, and for that we need lot of help. As a music therapist, we need a lot of help from various fraternities, like medical fraternity, neurologists, to the scientists, for allowing us or helping us to do the research work. And if we do not do it now, we'll never be able to do it, because West will take all. That is for sure. They understand and they realize and value our systems much more than we do. So they will take it away. And even if we do not do it now, we are losing it again. Just like we have lost a lot of things for yoga, right? And at the same time, so funds is required for that. So a lot of corporate involvement and government involvement is also required. At the same time, awareness in people, for like propagating music therapy is very, very important. So talks like this or seminars or wherever we can impart some sort of awareness, that will be very helpful, so that people can understand what music therapy is and what is the value. So when we say that we need to do the experiment and research and quantify the values of our raga system or music therapy system, we cannot forget the contribution of our ancestors. So experience and experiment must be going side by side, and there only will lie the success of our music therapy. So only then music therapy will succeed, and the actual value of music therapy, actual power of music therapy will be realized by us. Thank you so much.
My question is, this music therapy is a therapy, but as I understand, unless it is recognized by the authority,
Exactly.
possibly here Medical Council of India, you cannot practice it.
Yes.
If you practice, you will be taken as quack and something happens, and legal punishment will be decided.
No, it is totally a
What is the
natural
way out?
aspect. It is the way out is it will not be very legally against legal, because it is very much natural process. First thing.
I tell you,
I can give you a number of examples when doctors invited music therapists, along to work with them, all right, and recognize those. There are a lot of cases there.
doctor has got their license and
No, that is recognized. That is recognized. There is no specific organization that they can give you a certificate that you are a music therapist right now. That's what I have told you. But even if you, after that also, if you practice it, it is not going to be against legally. It is a part of music.
I guess, ma'am, all non-invasive techniques are legal.
Yeah, absolutely. Yes.
There is no.
There is no restriction on that. No restriction.
In Calcutta University,
Hmm.
for quite some time, they are carrying out projects with these
Music therapy, yeah.
dance therapy, what I heard of. Because my
Even
niece
music
is
therapy also they are
doing
doing. Lot of people are doing research, but there is no course for that. But those researches are recognized. After that, they're getting doctorates.
Yeah, yeah.
Lot of people are there. They're doing. So it is not against the legal authority or legal system. Not at all. That's for sure.
Do you think sensitization of music departments
Huh.
would help in recognizing music therapy?
Quite possible. Absolutely. Absolutely. And it is the need of the hour. So we have to talk in the line of music therapy. Only then they will be understanding that. Yeah. Yes, please.
I work in regulatory, formal regulatory as well as in medical health.
Hmm.
What I want to say that if you call it therapy,
Hmm.
there are two types of things. One is in medical conditions.
Right.
There you have a claim.
Hmm.
If you claim, then you have to go for a legal part. And if you don't claim anything, there are certain therapies which you don't need to claim.
Hmm.
So there you don't have any legal hassles.
Right. Here no
If I
claim
have
is
to
being
correct-
done.
Yeah.
Here no claim
I have
is
to
being done
correct
for music
this
therapy.
Because I work with ICMR and
Yeah. So that is what I was telling him. It is this not against
I
the
was
rule.
listening, so I thought how this can be taken up
Yes.
because I work with a lot of ministries.
Thank you so much. If you can progress that, that will be really wonderful. And the thing is, I'll tell you another angle to it. I'm working with one of the universities. We'll be, announcing it very shortly, of Punjab, for developing a course. And we are working with the hospital at the same time. We are not. It must be a collaborative effort. Only university and a music therapist cannot design
It
a
has
course
to
and
be
develop
the,
it. We are doing with the hospital, with the
Absolutely.
doctors. So there, if we are claiming, as Sir said, it will be actually, if we are not taking the permissions, it will be against the regulation.
I
So
think-
there it will. So the point is actually he is not saying when the report will go out, music will be an adjunct therapy here.
It's an-
What I am talking about is music as independent therapy should get the recognition. So that is very, very important. These are all thoughts that come from our ancestors. This is our responsibility to practice it. That's why I say with documentation is a must, so that the next generation, when they come, they have a ready reference. So our ancestors has done their work, beautiful, wonderful work.
Yes.
We cannot just sit on that and think that okay, they have done it. We have to practice that and make the documentation so that tradition continues.
Yes.
So all the living being, because the living being are part of that Om, the Nada,
Basically, it's an energy.
the Nada. So all
Thank
are
you.
part of that.
it was wonderful. It was the first time I had been exposed to this particular subject and mind-blowing, I must say.
Thank you so
We
much.
did not know that there's so many texts, ancient ones, and it's a cultural heritage. And if we do not practice it today and put it in some format, tomorrow
It will go.
some Abdul Rahman will patent it.
Exactly. True you are.
Sad but true.
True. But this is our job
There
now.
are so many rules and regulations to ensure that you don't work. Always rules are there to ensure that you do not have a choice for doing the research
Right,
on your own.
right.
And it's very sad. I agree with you 100%. Music therapy requires a lot of encouragement. Maybe you may be the one who will start it off.
Yeah, a lot of people are practicing in their own pockets actually, but all have to come together so that it starts as a movement. That is very, very important.
I think we can.
People are doing, one thing I wanted to talk about, this research that is being done in India on music therapy. These are not really quality work. I cannot give them a quality work stuff. They don't, yes, they're not getting the support. It is a total, as I told you, it's a total collaborative effort. I, being sitting here, cannot treat you and take, the measurement of blood pressure and respiration and say that I have done a research. This is not research. Many people are doing that. So this is actually devaluing our system. This should not be the thing.
So what I would
All-
suggest
yeah.
is, I would suggest that there is something called the Sangeet Natak Academy. Now, Sangeet Natak Academy, unfortunately, it is mostly hobby and entertainment. We need to bring the real strength of music
Right.
therapy, and through them also you should tie up. I mean, I think we need to structure a proper document so that you get the benefit of research from the Ministry of Culture as well as Ministry of Health.
Show light on different aspects, what you have said and what I am doing and what I have gone through. I am still a surgeon. I am a pediatric surgeon, pediatric heart surgeon, molecular biologist, stem cell technologist, doctor of yoga therapy, doctor of naturotherapy, and a music therapist. I have started a department and stem cell person. I have started a department of regenerative medicine without using any medicines, using only music is one part, then yoga not for doing yoga to communicate with the brain,
Right.
different centers in the brain. And for your information, music is the only thing which has many centers in the brain.
Absolutely,
And
yes.
whatever has gone wrong, we have to make new neuronal connections,
Right.
and we can make through music. So that is the
Absolutely.
part.
This is what we were discussing today. Thank you so much. Thank you so much. Thank you.